On to Instagram. My endometrioma ruptured and the ultrasound showed hemorrhage. That was about a week ago and I'm still in terrible pain. Pelvic, back, hips. How long will this last?
So endometriomas almost never rupture. So I'm kind of surprised to hear that it ruptured. Hemorrhagic cysts rupture, but the wall of an endometrioma is so thick, like I've almost never seen one rupture, spontaneously at least. How long will it last? I mean, it depends if you're bleeding internally or not. So I mean, I would go get that checked out.
Hi, Dr. VNT.
Okay.
How to know if a clinic's lab is good or not? Oof.
Ask for their success rates. Ask for what they use as techniques for complicated cases. So if everybody's getting the same treatment, that's probably not a great lab. If they're using different techniques, for example, Neupogen media, oocyte activation, special sperm selection processes, things like that, that's probably a lab that at least is willing to try different things. The other part of the lab, who's working there, right? Like, how long have they been an embryologist for? How many cases have they done? What kind of skill set do they have? What kind of training do they have? What kind of tests have they passed? That sort of stuff is important.
Does resveratrol and curcumin increase NK cell numbers?
Not that I'm aware of.
First time doing IVF, unexplained infertility, and Hashimoto's. 3 failed IUI with letrozole, 1 ruptured ectopic.
Oh,
Any specific cycle recommendations?
Yeah. Make sure your thyroid's good before you go into it. Be on the appropriate dose of meds. Don't go on birth control pill before you go in. If you're unexplained, I guess you're going to want to know what was actually wrong. So I'd want to kind of focus on, what was actually wrong. So, find out if they can get you a diagnosis. Not that IVF is wrong. IVF is great treatment for unexplained infertility. But if it's, for example, endo or adeno, the IVF is not going to overcome that, which is still being told to people all the time. So there was a post on Instagram about a lady that I think I put it up on her story, where on her ultrasound, it said like adenomyosis, fibroid, stuff like this. And they never even told her that was on the ultrasound. I got another patient that read that and then messaged me and told me that she had a 9-centimeter fibroid. 9 centimeters. I mean, that's a big fibroid, right? Huge. And they told her it didn't matter.
Oh, wow.
Like,
Dr. T would disagree with that.
Yeah, see, even Dr. T disagrees.
9 centimeters.
That's if he disagrees, come on.
Yeah,
right?
come on. Everyone should be.
Yeah, so I mean, like ridiculous, completely bonkers, nuts, like over the top. And people don't care. And there was just another, it was one of the studies I thought about presenting, but it was kind of too basic. So there's another study coming out very soon that shows that if you have endo, you decrease your chances of success, even when you're doing IVF. So when they tell you that IVF overcomes endo, it's just absolutely not true. It doesn't. Yeah, you got
to deal with it.
You still need to deal with the endo.
Yeah.
Yeah.
Endometriosis is one of the first subjects we talked about in this relationship of ours.
Was it really?
Yeah. I remember you telling me that, people think endo, you can solve it by doing how to treat endo.
Right.
And you were thinking people were suggesting you could treat it, by ultrasound, you can diagnose it or, Nope, you got to get in there.
Nope.
Yeah, I remember that.
Yep.
Endo's
it's a bitch.
Yeah, it's a real issue. It's a real issue. Yeah. Well said. Well said. I'm doing donor egg IVF.
Oh, cool.
And I have 1 day 6 euploid BA embryo. And should I do a natural modified letrozole cycle or HRT? I'm regular and ovulate and have no uterine issues such as fibroids. Been pregnant several times, but miscarry cause of my age.
Real quickly, yes, Carly, all the way to the end. Yeah, so okay, I got a couple of questions there. How did you do a donor egg cycle and only end up with one embryo would be my first question, because that's very unusual, unless you were using frozen eggs and had very few. But more importantly, I mean, you've only got one embryo, so I would be doing everything to optimize. So we would certainly talk to you about the opportunity to do fertilizers to kind of maximize your success rates. And then beyond that, we would also want to chat with you about, a letrozole protocol for sure. That is proven to have the highest success rates and the lowest risk of miscarriage. So, yeah, I mean, I would take every precaution and every scientific, sort of path that I could to maximize my chances of success because we're dealing with only one donor egg embryo. So A, I appreciate the fact that you probably spent a fortune for that one embryo. And B, I don't want to mess up your chances. So yeah, we would kind of offer you everything we could to give you the very, very best chance possible, whatever that meant for you. Now, I would need to know your particular history, but it's still really important to try and maximize everything.
Is red raspberry leaf tea still recommended to take before labor?
No,
My doula told me that it's no longer recommended.
no, it never has been recommended, and you should stay off of it. That stuff has prostaglandins in it, and it can cause problems, so stay away.
Hi, doctor.
Hello.
I'm currently doing IVF.
Okay.
I have endometriosis. I
Okay.
am having a lap next week.
Okay.
Do you recommend suppression after lap before I do my transfer?
Well, before or during, but yes, for sure. Someone asked me this the other day too, like you're never going to get all of the endo when you do a lap, no matter how good you are. I did endo surgery for 3 different people today. I got every single spot I could find. I'm still going to suppress them because even though I got all the spots I could find, you're never getting rid of all the endo. There's going to be cells here and there where they're individual cells. They're still multiplying. You can't see them yet. So yeah, you should always be suppressed. The suppression is what actually does the most. The surgery is helpful. Like one of the patients that I had today had a glob of endo about that big. I mean, suppression's not going to take care of that. You need to get in there and excise that, which we did, but you got to make sure that you are treating everything, and you can't treat everything because you can't see everything. So the best way to do that is suppression therapy with the surgery for the bigger parts, and then the suppression for everything you didn't get.
If lining needs estrogen to grow, how does an aromatase
Aromatase.
aromatase inhibitor letrozole cycle work for FET?
It doesn't prevent you from growing your lining. It's just keeping the estrogen level lower. So you don't need a sky high estrogen level to grow your lining. You just need a minimum amount, right? So that's just keeping it low.
Hi, Dr. VNT. Can you get PRP during the last month of Lupron if downregulating before your FET, or do you
Yeah.
have to wait until you start your cycle?
No, you can do it. No problem at all.
How can
We've
late
done that a
ovulation?
lot.
Oh, sorry. How
Okay.
can late ovulation be corrected?
Clomid, letrozole, injectables. There's lots of different ways to do it.
Team Money and Dr. V.
T-money. Oh, that's a new one.
They're having fun here. Can you explain more about immune protocols you recommend?
Well, that's a big topic,
Big
isn't
topic. Huge.
I'll give you some basics. If you have elevated NK cells, there are various options for you. Intralipids, steroids, Plaquenil, vaginal Viagra works fairly well. When we had it, SCIG and IVIG is still available, but very expensive. So there are a variety of different things that can manage your natural killer cells. If you have natural killer cell cytotoxicity, intralipids is quite good, as are SCIG and IVIG. If you have low T regulatory cells, you need LIT. If you have high cytokine ratios, you need either tacrolimus or sirolimus, or you could try Humira. All of those are reasonable. If you have low antipaternal antibodies, you need LIT. If you have DQ alpha, we're still not sure, but Fertilis strongly believes in LIT, and Dr. Zaneku does not, but they disagree on that one. And then if you have The KIR mismatches, that's complicated. You either need a surrogate or you need Neupogen, although I'm not entirely convinced it works. Having said that, one of our patients is about to deliver and she was on it, so who knows? You look puzzled.
Yeah, I was trying to find one of one. They wrote question 2 of 2, but I'm not seeing